is a statement put out by senior cabinet minister in the Maharashtra government, Mr. Nawab Malik. He joins us live this morning. I would like to welcome Mr. Nawab Malik to Mirror Now. Thanks for joining us, Mr. Malik. You've made this announcement in a tweet that you would like the bank EMIs of loans taken on homes, small businesses and auto rickshaws to be deferred for 3 months. Now, you have also said that the payments should be rescheduled and RBI must instruct the banks to do so immediately. So first of all, of course, these are certain measures that are directed towards easing out matters for the people. So perhaps a lot of people would welcome such a move. But do you think this is practically possible? Is it feasible, Mr. Malik?
Definitely, a lot of people has taken loan for their houses, vehicles, rickshaws, or small appliances in the home, but they are not in a situation to pay back EMIs. So there should be a decision by the government. The directive has been to be given by the RBI to the bank. This all EMI should be deferred at least for 3 months, and it should be rescheduled. The basic amount can be merged with the principal amount. And I also demand from the center the same for 3 months should be waived.
All right. Okay, so there has been some thinking behind this. I understand that this has come at a very appropriate time for a lot of people would be expecting more measures of that nature since we are in a situation where there is very limited cash flow. But I would like to now focus on certain other issues that the state is facing, Mr. Malik, since we have you on the show. During this period of lockdown, the government of the day has a huge responsibility. Firstly, to make it an effective lockdown. That's the only solution to the pandemic right now. But at the same time, while you restrict movement, you have to make sure that people have enough supplies. Is enough being done towards that? How are you going to maintain this tough balance while restricting movements, making sure that people have what they need in their homes, Mr. Malik?
See, yesterday Mr. Uddhav Thackeray has taken a decision that all essential shops, grocery shop, medical shop, any other services which is required for day-to-day needs will be open 24 by 7. And despite that, Deputy CM has made a meeting with various officers and he has said the movement of truck for essential commodity should be allowed. And definitely today some more measures will be taken that the material should be lifted from the farmers, various food chain should be created, and definitely we will ensure that the food supply, essential commodity supply will not be affected and necessary measure will be taken.
Yes, while you say that, now let me come to specific cases, what we have been reporting, because our reporters are doing ground checks. It's one thing for the government to say we are ensuring uninterrupted supply, but on ground, what do we see? Like we witnessed very long queues outside LPG cylinder outlets. Now that has happened because these suppliers say that they do not have the delivery boys right now who are, of course, staying indoors, fearing that they may contract the virus. They're not doing their jobs of delivering the cylinders. That has led to a situation of people queuing up. This is just one case. So while the government may allow the services to function, there are practical problems of manpower. How would you address that? Are you in touch as a senior cabinet minister in the government, really in touch with those suppliers who are working, to make it possible as well?
See, today I'm just leaving my house to the Mantralaya. I'm having a meeting with DCM, and we will tell the suppliers that they must get the truck at the doorstep of the various societies, various mohallas, various slum areas, where the people will come with their empty cylinder and it can be delivered to them. If the people are scared, the workers are not attending their chains. So it is necessary that drugs and all
Yes.
material should be reached to the doorstep of the people.
Okay. Right. But there is, yes. Yes, there is a manpower crisis. A lot of industries need manpower, human labor to operate. And since we talked about cooking gas, let's also talk about essentials like the vegetables, which have to be made available to people. Now, for that, the supply chain from the farmers where it is loaded right up to your wholesale markets, even there are huge bottlenecks, Mr. Malik, if you're aware, because we've been reporting on this, how the trucks are not being able to be loaded in the first place. So while these announcements and exemptions are made, manpower crisis remains, and there are several examples like this which need to be addressed. With what urgency are you dealing with this? Because today is day 3, and of course with time people will need to replenish their stocks at home.
See, definitely this is the crisis is there. We accept it. Yesterday, Mr. Ajit Pawar has conducted a meeting where he said that many of the trucks should be acquired, the vegetables should be lifted from the farmers, and it should be delivered to the APMCs, if possible, to the society. We are planning that some of the small vendors will allow to go to the society and sell their stuff into the society's various slum. Despite people going to market, the vendor should go to the doorstep of the people. This kind of a chain will be definitely will start. In Parbhani, before 3 days, being a guardian minister to Parbhani, we started that kind of a chain in Parbhani.
Right. Of course, you're aware that Maharashtra is one of the worst hit states. The numbers have gone beyond 120. The idea is now, of course, to make people extremely aware that they cannot step out. Yet we see violations happening. So, one hand, the police has the job of restricting public movement. But on the other hand, Mr. Malik, we have seen police also exceeding its brief. Now, it is its job to make sure that people are not loitering around without any purpose, but there is some kind of excesses that have been witnessed. Is there any policy to make or sensitize the police, make it aware that while they follow the enforcement policy, there cannot be these kind of excesses of, say, beating up vegetable shops, asking them to close down immediately?
This is never been supported by any of the government or any of the person. Some kind of a exceeding handling manpower in different manner cannot be tolerated. DCPs and various higher police officers has been directed that you must counsel your constable on the field and they must not behave like that.
Right, but it is happening day in and day out. Of course, there is a fear that when people are overcrowding, then what can the police do? There must be a policy in place. It simply doesn't, do anybody good to resort to, say, lathi charge. What is the policy that the government is following? Say, for instance, if there is overcrowding in one particular vegetable market, what should the police be doing under such circumstances?
In Dharavi, police has started taken a huge ground. They had created a new market and they had made some circles that social distancing should be there. So in many of the police station areas, police themselves are creating some kind of a new method to provide the essential commodities to the people of that locality. Definitely, the sudden lockdown announced by Prime Minister has been created panic into the citizen of the country. People were started bug buying. They rushed to the stores and they started buying more than what they required. So in beginning there was a panic, but people now understand that essential commodities will be available to the people, and now it is where the rush were there at the shop. Now it is reduced.
Right. Let's, in fact, quickly also bring up the issue of health infrastructure, Mr. Malik. Now, of course, there are very big concerns around whether a testing facility is easily accessible. Private laboratories have been roped in by under the ambit of the ICMR. But in Maharashtra, what is your view on whether we have enough facilities for testing? If we do not pace up testing, we will not detect cases, and those undetected cases will continue spreading the virus. Is the government, does the government have a grip on that at this point in time?
See, every district we had started this kind of a facility. Even in private lab, it is also permitted. In beginning, center was not allowing us to start in private lab, and in various places the kit were be
Mm-hmm.
made available by the center. Now it is allowed by the center. We had allowed many of the private lab to get investigation of this kind of a virus.
Yes.
So in beginning there was a problem. Now it is shut out, but we have to vigil. Our health minister, Mr. Tope, is working 24 by 7, having touch with the center and every district, every hospital. We are creating more ventilator, more ICUs, more isolated uh, wards in various district hospital, city hospital, and we are trying our best to do that.
Right. We are also receiving information, Mr. Malik, that six secretaries of the government of Maharashtra are being given additional responsibility. How are you going to make that network of the bureaucrats, monitor the situation? And with the private hospitals now coming under the ambit, are there also worries whether they will follow the necessary protocol? Is there any vigilance on that part as well? Because as of now, 19 hospitals have the testing centers, 8 run by BMC, 11 private hospitals. Now, when it comes to the private hospitals, what is the level of monitoring or ensuring that they follow the necessary protocols? Are they equally reliable?
Definitely, all things are measured, then it is allowed in private hospitals. I want to say you that every guardian minister is just active in their own district. They are monitoring from morning to evening. Every direction should be given to the
Okay.
collector or the police officers, and we are monitoring the situation. Where the permission has been given to the hospital, they are monitored. Our Secretary
Mm-hmm.
Health, Mr. Joshi, is monitoring everything. So every department in the government offices are active. Even the secretaries are given responsibility. All ministers, those who are guardian minister, they are monitoring the situation.
Right. Since we are doing extensive, reporting on specific cases of where things are not going well, let me give you an example. An elderly couple, for instance, they are the vulnerable group. Obviously, by now everyone is aware that the senior citizens are well advised to stay indoors, so they cannot ideally or should not step out. Now, what is a couple like that who live alone, perhaps, with the domestic help not coming in? How do they manage things, sir? Have you thought about that segment of our population? Because while we say that home deliveries are allowed, those things are not working smoothly. I've been telling you time and again that a lot of the employers report, when we talk to them, saying that their employees are not showing up for work. So the delivery boys, even for a Zomato or a Swiggy or a Uber Eats, is not functioning like normal times. Have you thought about this segment of population in our state? The elderly who live alone, who do not have domestic help coming in, perhaps also having health problems that they cannot do all the work by themselves. How are you taking care of their plight?
See, I'll give an example. Mr. Mago is residing at Devna Farmhouse, Madhuban Society. Yesterday, he has SMS me that they are both of them are senior citizen. Wife is paralyzed and he is suffering very much. So he has given me the servant number. We has coordinated with the this DCP, Mr. Meena, and we had provide him help. Whenever people are demanding any kind of a help,
Right.
the entire administration is very much active, and delivery system was stopped earlier. Now it is permitted.
Right. It's a matter of survival, and I hope that the government of Maharashtra is doing its bit to understand the specific problems of specific segments. While we address the issues of the poor, the small businesses, there is also the elderly. Mr. Malik, are you satisfied with the way the central government has taken these measures of 1.7 crore relief package? And also the measures coming in towards protecting small businesses, because Maharashtra again is the hub of industry. Mumbai is the financial capital. Do you have a plan in place on how you are going to restore things once this lockdown period is over?
Definitely, now the priority is to prevent the people from the corona. Definitely, after lockdown will be over, the situation will be under control. Definitely, measures should be taken to revive the economy of the country as well as Maharashtra. As far as the concern that central government has taken a decision giving a package to the people, definitely it is welcome, but urban poor, unorganized labor are not addressed. We are demanding there should be some measures for them also, and definitely state will going to take some
Mhm.
measures to give relief to the people of Maharashtra.
All right. We will, of course, keep a tab on how the small businesses, the poor, the underprivileged are being protected by the government, by your government in the state of Maharashtra. But thanks so much, Mr. Nawab Malik, for joining us this morning and for sharing with us the steps taken by the Maharashtra government to mitigate the coronavirus.